Well, joining the company now is Dr. Sreedhar Potarazu. Doctor is with us, as he frequently is, and welcome back, sir.
Thanks for having me back.
Right. The Supreme Court rules on the constitutionality of Obamacare. We think June or July. Well, that gives us 6 months between now and then. Is everything on hold? Is that the healthcare system and any changes there too totally on hold for the next 6 months?
Yeah, pretty much.
Is it?
Because the first arguments are going to be heard by the end of March,
right,
and everybody is waiting with bated breath. The states, the insurance companies, in terms of what they need to respond to.
But isn't there a timetable laid out, almost set in stone, as to what we've got to do as we approach the full implementation of Obamacare? You're saying that's off the table now? You can't do anything?
The ironic thing is that the hundreds of millions of dollars are still rolling out as per the law in terms of grants from HHS for the states to implement the exchanges, for doctors to implement electronic medical records. All of this is still moving as if nothing is going to happen. The scary part is, several months from now, if all of this gets repealed, you're talking about a huge impact on what we're scrambling to rectify right now, which is the deficit.
Well, can you do anything with those hundreds of millions of dollars that are rolling out? What were you saying about that a moment ago?
No, I think it's a disaster because you think about it, it continues between doctor and patient, grows wider and wider each and every day. For the doctor's offices, for their billing alone is already went from 30 to 60 days. Now some of the doctors are 120 days plus to be able to recoup their funds.
That's right.
That means every single billing code has to change with Obamacare. I don't think people understand how many codes. That means if you use a tissue, you have a blood test, everything that's done is a code. It's a nightmare for our medical community.
And are you saying we cannot change those codes over the next 6 months?
We don't know what it is.
We're on hold?
People don't know what to respond to. So I think that's a good point. Look at what passed, yesterday, even with Medicare. Right. If you defer now the cuts we've been talking about, and every couple of months we keep postponing this deadline, eventually doctors are now sitting in limbo about whether they should actually start seeing Medicare patients. Exactly. Because they don't know whether they're going to get paid or not.
Right.
Medicare has come back and said, look, we're going to hold on payments, they said earlier, until we know what the verdict is. But there are a lot of people sitting on the sideline, I can tell you, from, within the real world of medicine who are saying, maybe I shouldn't even take on Medicare patients.
Because why invest the money? It's exactly like the $600 goofiness that they put in us. All the businesses scrambled to say, okay, I need to start getting all this information. We put a ton of money into our admin to get ready for it, and then they changed it anyhow. This is exactly what's happened. Do I invest the money, or do I invest it in my practice?
Dave?
Left out of this conversation is the small businesses who are all, as you say, in limbo. That's why so much money, in part, is sitting on the sidelines in our economy, because they don't know what implementations, what changes these small businesses have to make. So that's another scary aspect of the decision.
20 seconds left. What's your betting? Is it approved by the Supreme Court? It is constitutional, or no?
I think that the Supreme Court is going to rule that it's constitutional because a lot of the ruling is going to depend upon Justice Kennedy.
Really?
And that's my gut.
You think it's a go?
I think that it's going to be a go, but I still think that the election will determine, obviously, depending upon who gets the Senate, of whether it actually gets implemented or not. So I think that's what's going to happen. So it's going to be a lot of touch and go.
All right. Dr. Sreedhar Potarazu, always a pleasure.